Hello, this is School Committee Update with Dr. Emily Ackman, Ward 1 and Vice Chair of the School Committee. Hi, Emily. This is Sarah
Hi,
Fishman.
Sarah. Thanks for having me.
Oh, yes, this is fun. A new virtual experience, a
It
real
is.
virtual experience for me. So I'd like to start just with a little bio. If you could tell us how long you've been on the school committee and that kind of thing.
Sure. I am in my wrapping up now, my third year on the school committee. Time flies. And I have a PhD in education policy and evaluation. And that was sort of one of the reasons I ran, is that in my professional life, I spent a lot of time sort of figuring out what the best policies are to serve students in the most equitable, economic and efficient ways. And so I was hoping to sort of to bring that expertise and serve the students and the families of Somerville using that skill set. I'll leave it there. I can dig in more, but I don't want to bore
That was
people.
one of the things I was going to ask you about. How do you think it changed how you've performed or thought as a school committee member? Can you think of an example of how that informed how you approached something or voted or anything like that?
Sure. I mean, I can say something that one of the things that is, well, I will give two examples, one that's sort of older and one that's newer. And one of the things I think is endlessly fascinating. So research indicates, and it's pretty broad consensus, that for high school students, later starts are better because sort of the way the teenage body works is that sleeping in on average is better for them. So that's like, there's a pretty solid body of research. And one of the things that Somerville High School is doing, especially in this online environment, is not starting until 9 a.m. And during our most recent school committee meeting, one of the two student representatives asked if Somerville High could start an hour earlier. She said that there are a lot of families, because Somerville High starts later than the rest of the schools in the district because there are older siblings who need to take care of younger siblings. That chunk of time at the end of the day, after their siblings have gotten out, but before they technically get out of school, is a very difficult time for families. And, one of the things she said is most of the high school students, I think, won't have a problem waking up earlier for it. And I thought it was interesting because, if you had asked me objectively before hearing from this student, my response would have been like, absolutely not. Like, the research says this is what we should do. But when you start to hear from students, that's the nature of research.
Customers.
Yes. Yeah, exactly. And so I thought that was, I think if you find on the video, that was our last school committee meeting. And in my head, I remember thinking, like, the research is very consistent on this, but here is a high school junior asking for school to start an hour earlier. I was like, all right, that's significant. And if we're really trying to meet their needs, that's something that, we're considering and have talked to the principal about.
It's good. It's good to be heard, right?
Yes. Yeah. But that's the most recent example.
Yeah. So how long have you lived in Somerville?
Since 2011.
Okay. And you have two school-age children. May I ask their ages?
Yes, they just turned 4 and 5. So
Okay.
The 5-year-old has missed the cutoff for kindergarten. So they're both still in preschool.
Okay. So you're dealing with COVID are they at home or are they elsewhere, or
So they were the Elizabeth Peabody House, which is a preschool on Broadway. An amazing nonprofit, which I, am very proud to support because they have a food pantry as well as, their preschool, and an after school service as well. They, my children were originally at preschool around the corner from my house at Bellas Manitas, which is a bilingual preschool, which is across the street from the East Somerville Community School. They were in the same class there, and, we're starting to have some conflict. And so we switched them over to the Elizabeth Peabody House just about a year ago, because they have 2 classes there, so they could each be in their own classroom and have some autonomy. And so the Elizabeth Peabody House closed, I think it was March 13th, whatever the day was that, that Somerville Public Schools shut down. They go according to Somerville's schedule. And the kids were home with us for exactly 4 months. They went back July 13th. And so I know that, my spouse and I are very lucky because we've both been forced to work from home, that we're not doing that same full-on juggling that many families are, because my kids have 8 hours of care a day out of the house. They wear masks full-time, and, practice social distancing and do lots of hand washing. But that is, since July, we've had that coverage.
But you still had the 4 months where that wasn't the case. And I'm just wondering how it affected you and how it affected your children. And by way of saying, is there any advice or suggestions that you would want to share with families in general about how to cope?
Oh, well, humor is number one. For me, I think I'll think about my family, but as well as sort of the time of year we're going into, I think being outside as much as possible is good for just all bodies. If you have the means of getting to a green space, that helps my mental well-being, not just moving, but being around trees and plants. And one of the things I will say is, because there is this move to get outside, especially as the weather's getting colder, I know that the Somerville Family Learning Collaborative, the SFLC, is doing a winter clothes drive right now, in order to help make sure that all families sort of have the means to get their kids outside this winter as much as possible.
Where do people make those donations? If people have something to donate, where do they?
I assume, I don't have the answer. I assume it is at their building, which is, I don't remember what street it's on. It's right outside Union Square.
Okay. Well, people can Google the.
Yes.
Right.
The easiest thing to do is Google Somerville and SFLC,
Okay.
and then they should find it.
Okay.
And then, but yeah, so I would say getting outside in appropriate clothing as it gets colder out. For us, it was the norm of hand washing, every time we came in the house, carrying a little thing of hand sanitizer with us, and making masks, wearing masks, normalizing that. And one of the things that we do is, we started to just treat our masks like underwear. At the end of the day, it goes away and you have a new one. And then another thing that we have done in our family is we just recently purchased a seasonal affectiveness disorder lamp that everyone in our family uses for 10 minutes a piece in the morning. And I don't know if it's helping, but we are approaching very rapidly the darkest time of year around here, and that can negatively affect people's mental health. And so the short answer to your earlier question is like keeping mental health a priority, however you can. So, and trying to be aware of that. But those are my tangible suggestions as well.
That's good. That's helpful. So what have Ward 1 residents come to you with? What are they talking about most, or do they have specific concerns that they have been voicing?
And it's mostly been, is school reopening, and then is it safe to go back? And you know, I don't think that we can ever say that we can guarantee safety. But, you know, in life, once you choose to leave your home, you can't guarantee safety, especially in an urban environment. Last week, there was a woman who was hit by a car and killed on her way to vote. You know, that's like, there are risks.
In Kidder Ave?
Yes, yes. And she was apparently a CHA researcher for Cambridge Health Alliance, and as I've been told, really did amazing things for children in this community. So it's really a loss.
40 years old or something like that.
She was, as am I. So it really struck a nerve.
Yeah, yeah. Okay, so yeah, the COVID is the not so invisible elephant in the room. So let's get on that.
Yeah.
So the plan at one point, or is maybe still, is to have some students go into the classroom next month. Still the plan right now?
Yes.
Okay. And how is this going to happen? Which students are going to be there? And how many? What will it look like?
So I can tell you who. I don't have the numbers yet. I think the district is still contacting the families about who wants to come and who isn't. And so my understanding is by our school committee meeting, which will be on Monday evening, we'll have tentative numbers. You know, as the superintendent has said publicly, based on her experiences and what she's heard from other colleagues, there are families who say, like, yes, we'll go back, and literally they walk up to the door and don't feel comfortable sending their kids in. And, you know, there are things, it's understandable. So we know that no matter what the numbers are, those are going to be in flux. But the highest needs students right now, which are special education students, will be coming back on December 3rd, and they will be attending Monday, Tuesday, Thursday, and Friday in person. And then pretty soon after that, I think it's December 7th, which is the following Monday, level 1 and level 2 English language learner students, which are the students with the highest language needs, will be also going back Monday, Tuesday, Thursday, Friday. And then again, a few days after that, we'll be bringing in our pre-K and K students. And that is cohort A will be Monday and Tuesday. Cohort B will be Thursday and Friday. They will both have Wednesday being being online. And then cohort A will have online learning Thursday and Friday, and cohort B on Monday and Tuesday will have online learning.
Wow. So someone was asking me, so that's how it's going to be set up. So why was that chosen as opposed to, say, 1 week in classroom, 1 week not, 1 week in, 1 week not?
I think I don't totally remember. I think it's a space issue. Okay. And we're trying to work because the first buildings to come online are going to be the Capuano, Argenziano, and the West.
Right.
And so, and because we need to guarantee space for the special education students and the English language students, once they all have, 6 feet, the appropriate space, also the appropriate space for their needs, that the schedule is sort of determined. It started with space. I don't know why. I don't know why it wasn't week on, week off, but I think
someone just asked me. So, I mean, there are so many different ways to do this. And
yes,
the one thing I'm struck by is the number of cases is rising. So, I mean, what are the metrics that the district uses to determine whether or not they move forward with more in-classroom instruction? Is there some point at which, too much is happening, too much COVID increase is happening to warrant re-entering schools or not?
I will say that that decision hasn't been made for the district. One of the things that, because the city owns our buildings and is in charge of our buildings,
Right.
the mayor, the Department of Health and Human Services, the standards to which they're putting the ventilation system, the goal of that is so that is that despite higher and higher increases, that people can still feel safe sending kids. That's the goal of this, like, increased ventilation. Right now, the school committee is sort of relying on the city to give, to have the metric. And we have not, the school committee nor the district has come up with our own metric for that, because we don't have an epidemiologist or on hand. So right now, that's our choice. We could choose to have our own metric. As of right now, we do not. We're relying on the city's metrics.
Right. If you had to grade the city, scale of 1 to 10 on effective COVID response, how well would you, what rating would you give the city? I've asked other people this, so I'm not singling you out.
Oh, thank you. I mean, effective in keeping COVID at bay in a, very densely packed city, I would say I would rank them very high. Mm-hmm. A 9 or a 10. Like they've done a lot of work. The challenge would more coming in sort of to your earlier question, when I said I think mental health is the priority and is important right now, there's just balancing that mental health and well-being piece with, as strictly as possible, following the rules that will keep you safe in a scenario like this. And, I think the city has done a great job of trying to keep coronavirus at bay. And, we don't yet know what the cost of that is as far as mental health of citizens.
Is there any, this is a little philosophical almost, but is there any irony or ironic contrast in how conservative the mayor Somerville is being with openings and being more cautious than, say, the state is with reopening the economy? Is there any, if you look at that compared to going back into the classroom, I mean, so far Somerville's been only remote, and that's only remote learning, and that's sort of, in my mind, similar policy-wise to mm-hmm. being slow to ramp things up elsewhere in the city. Mm-hmm. So is there any dissonance in going back in that you see, or is that not really a question?
No, I don't think, I think the dissonance comes more from the state pushing really hard. I do think that objectively in-person learning is what is best for most kids. I'm certainly not going to say all. There are, certain kids who for some reason are going to thrive in a digital environment. But again, it's just balancing those factors. So that's, to me, where the rub is. My son is crying in the background, so if you hear it, I apologize. Oh. My husband is my husband's here and dealing with him. It's we're coming on what a friend refers to as the witching hour, starting at about 4 to 6 when you have young kids is yes. when things get a little rougher. Anyway, I apologize. So yeah, I think that's the challenge, is that, it feels, and I understand, the governor and the commissioner are thinking statewide and not thinking about, the specificity of urban environments. And again, Somerville, even compared to all the other cities in this state or in New England, is the most densely packed. So there are just certain factors that we have to consider. And what was interesting is moving into the pandemic, space was an issue. Space was already an issue in Somerville. One of the things that I've sort of pushed for in every budget cycle is having smaller student to teacher ratios in the lower grades. And every time I've been told we don't have the space to do it. And so, Somerville had space and capacity challenges before a pandemic hit where the solution is space.
Okay, well, let's talk about buildings, because the ventilation issue is a really big one. This is a way of circulating air, right, so that the virus can't just hang out. And basically all the buildings, except for maybe the new high school, are going to need something. But the three you mentioned have been grouped together, Argenziano, Capuano, West Somerville, as needing not so much work, I guess. And has the bidding process started for doing that work?
My understanding is it has. The one thing I will say, I'll do my best to answer your questions about the buildings, but like I said, they're owned by the city.
Right.
And so we just get updates from the city. And so I
watched part of it on the November 2nd school committee meeting. Yeah. And it was more detailed than I would have expected, maybe. But so I guess the question is, if you're going to have kids going back into a school next month, where are they going, kind of thing, if these buildings, will a building be ready, or is there a building already ready, or?
So my understanding is that none of the buildings are ready yet.
Okay.
The mayor seems supremely confident that those three buildings will be ready by December 3rd. And so all we can do is put our faith in, the mayor and Rick, the person who oversees buildings, and his team. I know that also next month is when the city officially hands the new high school over to the district. So we can also start sort of figuring out space issues in that building.
Yeah. So sorry, I have to ask this question, because
of course,
my son went to the Brown School when it was still K through 6. So it's one of two buildings that is deemed needing a longer term strategy. Previously, it was given an even more unflattering adjective. So what's going to happen with those buildings, or is it just too soon to say, or?
I mean, the short is that it's too soon to say. The thing is the technicality is it's deemed not viable during the pandemic. And, we don't know how long it will last. If ideally it's over by the end of this school year, then kids can be back in fall of September or late August of 21.
Kids in that school, I think.
There are. And like I said, there were already space issues in the district before this. So, that's like, the short answer is we don't have space in the other buildings, I think, for those 200 students. So we need that space. But
this has been an issue for so long. There was one time when the previous principal of the Brown School put her desk in this little small space, and they said to her, Thelma, Mrs. Davis, you realize that's like a broom closet. And she says it's like the only space that she could find. I might be warping, some of my details might be off, but the general story is true.
Yeah.
Okay, so we don't have a whole lot more time. I want to talk a little bit about the Tufts pooled testing protocol. Can you just explain exactly what that is and when it'll start?
Sure. So I think pretty soon, I think right after Thanksgiving is when the baseline testing is going to be done for all the teachers who are going back. And
teachers and staff too?
Teachers and staff. Yeah, sorry, all staff. And then once kids start going back, the they'll be doing the nasal swab. So again, I'm fortunate. My spouse is a graduate student at Tufts, and so has been doing this already. He gets swabbed weekly, and actually did this morning. And so I know a lot about the specifics of what it is it's, you just, as I have received coronavirus tests 4 times now, and I've had the eyeball poking ones, and it is fairly uncomfortable. And I'm really happy that for the sake of our students, we're not doing that. But so the protocol is that it will be, the lower part of your nose, sort of what we think of as the nostrils, will be swabbed. Probably it will be by an adult, at Tufts.
It said in the report that K through 8 students, someone would do it for them.
Okay.
High schoolers and teachers would do it themselves.
Okay. Yeah. So
It's a program.
Yes. And so like I said, when he goes and does it himself, but for younger kids, they will have someone do it. And then it just gets put in a, your number, I assume it will be affiliated with the student ID number. It gets put in a container. That's, what he says. And then when the container is filled, it gets sent off. And as long as they're all negative, they just get, but I think that's the pool testing, is that they're not each individually tested
Right.
for coronavirus. Like as a group, they're tested. And then if there is a positive in that group of, I think it's 13 or 15, everyone else, all 15 of them then have to test again.
And that's still cheaper by a long shot, apparently, than starting out with the individual stuff.
Yes.
So now we have to officially wrap up, but I wanted to see if you had any announcements. I know you've been doing virtual office hours. Do you have anything to announce or anything?
We don't have virtual office hours yet. I would say that at the next school committee meeting, which is Monday evening, our vaccine policy.
What date? Because this is running multiple.
I apologize. It will be on Monday, November 16th at 7 p.m.
Okay. All right.
And we will be discussing our vaccine policy. And so, if you have thoughts or an opinion on it, we have it posted, and we have a vaccine policy that we will be discussing. But if you'd like to give us your thoughts and feedback on, specifically, it's going to be the flu vaccine, and the mandate from the state is that you have to have a flu vaccine, not just to enter hybrid, but by December 31st of this year, any student who will be even fully online in Somerville has to have a flu vaccine.
Wow.
Yes.
All right. That's good to know. And on that important note, finished. This has been School Committee Update with Dr. Emily Ackman. Have a good day.
Thank you. You as well. Thanks for your time.